Hey, good morning, y'all. Welcome back if you've been watching any of this. I went scrolling around. I was like, I wonder how I can improve my YouTube channel. I need a niche. I don't have a niche. And somewhere it said, niche is yourself. Well, here you go. My experiences and or my observations and my curiosities all fall into this channel. So, the most recent, I was watching a short. And it was probably one of those, it's one of those medical sitcoms, and I can't think of which one it actually is. However, it spawned something in my brain to think about. What if? Okay. So, currently in the United States, we have this major opiate epidemic, right? And we have this silly, like, coming out of the fucking woodwork of people who have these substance abuse and drug addiction and alcoholism, yada, 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 yada. It's like, it's rampant, right? Now, I'm 75 days sober, so I feel like I have a little bit of a right to talk about this subject in general. Now, in order to keep myself on track, I wrote some notes here because I I get on a tangent and I don't get off it, and I start branching and shit. Okay. So the thing is, it's like I'm curious. Is there any sort of like statistical like record? Has anybody been actually writing the progress notes down in the medical establishment of the people that, like, for example, big huge hospitals, they have a plethora of different types of people come in all the fucking time with overdoses, and or it's the chronic drug addict being found on the street, being brought in, and they're like, yeah, he's just a druggie, whatever, and they don't care, and they dismiss them. They treat the symptoms or send them to jail or something of that accord. And yeah, there's shorts all over the place where like the one guy, apparently he was homeless and he was like strung out on something, and he was complaining about having something wrong with him, and they dismissed him because they didn't fucking care. And the guy died in the back of the cop car as the cops were taking him away. That kind of shit. All right. So I'm sitting there thinking, do the medical professionals are like, oh, they don't have time? Yeah, maybe we should reconfigure the way fucking medical care is being conducted. Maybe we should have somebody who's compassionate come in and talk to, like the sitcoms got, the patient, to get some kind of backstory. And write it down correctly. Because I can almost bet any kind of money on my own perceptions of what I've seen in the world and have experienced in my own self into regard to alcohol use, that they're self-medicating something. It's not an addiction. It's an aphrodisiac dependency. You see, when they go to doctors, because I've been gaslit and or neglected in some of the shit that I need to have tested and cared, under a physician's care. See, they don't look into, for example, my back pain. When I went to my doctor, she did get me a referral to something I shouldn't even need a referral. I should be able to call up there and be like, yes, it's part of my 80% that I get from the military. I need a follow-up appointment because I need regular adjustments and whatnot, right? I shouldn't need a fucking referral, okay? However, the back pain wasn't even needing a chiropractor. It needed attention on my kidneys because I was passing kidney stones. And I did them naturally, and it was painful as fuck. And struggling with that was causing a mild infection. And I treated that with over-the-counter stuff. Now, anybody who doesn't know anything about medical, they might have actually resorted to drinking themselves into a stupor because the pain is that fucking bad. And if you're a, alcoholic, and you've been dry for an extended period of time, and in order to kill the pain of something like that, you resorted to alcohol because it's legal, and then put yourself back into a cycle of alcoholism because it just takes one drink to send you into a fucking blackout. But the pain is so bad that you're self-medicating. You see where I'm going with this? My PC fucked up. But the point is, the medical system ignores people's actual issues because they don't want to be fucking bothered. Now, there's a lot of cases that come in there that are dismissive, ignorant people, which is why I emphasize getting your education on. Learn something. Don't run to the fucking doctor every time you have a tummy ache. Unless you have something documented that would attribute, hey, I have this and it's causing my stomach to ache and I need to be seen by you because it could be deadly. A lot of people don't know they got anything wrong with them because the medical system has fucking dismissed their pain. Just give them some fucking narcotics and get them addicted to it. That'll help. So I'm curious what the statistic is for a lot of these people who are addicted to narcotic pills and or anything from street drugs all the way to fucking alcohol, who are self-medicating their conditions because there's no mental health that gives a fuck about listening to their backstory. There's no social system that gives a fuck of listening to their backstory, because I can guarantee a lot of these young kids, they're probably experiencing trauma and they're self-medicating to escape the emotional pain because they haven't had any kind of therapy to help them move past it. There's that. There's spouses that lose their spouse to cancers and or other things, car accidents, whatever, and they need psychological support to get over and past that loss. And they get ignored. And nobody fucking cares. So, my point is, the negligence on the medical profession's part is abhorrent. It's this nontranferrence, the negligence, lack of vital concern. Yeah. I have my progress notes for my PC. They don't listen because they don't fucking care. She has not read my medical history because she does not fucking care. Anyway, yeah, the notes of not detailing, failing to dictate actual stories of patients. Now, some people might lie. Some people may lay it all out there and tell you their whole fucking story. You gotta listen. And that's what we have a problem in this fucking country with addiction and whatnot and substance abuse and aphrodisiac addiction. Because the people who are supposed to be fucking concerned and writing notes and getting people health within our medical care system, or fucking our sick care system, rather, don't give a fuck. You want to fix the fucking epidemics of substance abuse and alcoholism Maybe we need to, add a course or two of continuing education to all of these medical practitioners, to, a course in fucking empathy. Yeah, let's start there. And we might find that the abuse decreases. Because I can guarantee that the majority of the reason why these people are on something is because they've got emotional, physical, and psychological issues that nobody fucking cares about. So they're self-medicating their pain away. Yeah. What is the age that most girls would consider starting cigarettes? Right around the time of their period. Yeah. And the ones that I know of that did grow up smoking, yeah, we had fucking issues that we couldn't discuss with our parents, and our parents thought something was wrong with us, and they did consult medical professions, and the medical profession said, oh, it's just a phase. No course of nutrition that parents could have probably implemented in order to balance the fucking hormonal crazy to keep their daughters from falling back on a substance to keep them sane. Like nicotine is an aphrodisiac. It does. It calms the nerves. There's an anxiety there. My situation as to why I smoked and why I consume nicotine now is completely different than somebody else's probably. But I continue to do it because it keeps me sane. It's gone on too long, so the body is dependent on it. Now, it's not killing anybody but me. However, most doctors turn a blind eye to the reasons why it was that I started to begin with. Now, I know the reasons why I started to begin with. Nobody cares why I started to begin with. I'm 52 fucking years old now. What are they going to do? But we don't address it early enough. And then when it gets to be a problem, oh, now everybody wants to fucking help. No, you're not helping. You're dismissing. You're neglecting. You're ignoring. And the non-compassionate attitude amongst the medical community is fucking shameful. So if you're struggling with addiction, you're struggling with substance abuse, or you have a, weird habit, obsessive compulsive video gaming, maybe you might want to do your shadow work, figure out what the fuck it is that's causing you to want to take something to ease your pain, because it's likely that up there, or something physical. That needs to be addressed. And the doctors are fucking ignoring you. That's where most people who have educated themselves within the medical, I mean, we don't know everything, but we're pretty well versed on our own shit. Doctors fucking hate us. Because the first thing they want to do is throw a fucking pill at you. And you're like, no. Do your fucking job. Find an alternative. Go learn some fucking nutrition. See if we can fix this without Big Pharma being involved. Oh no, they wouldn't make any money that way. Have a great day, y'all. I gotta go get ready for work. Peace.